It's perfect.
All right, recording good. All right. So, hi everyone. Welcome to Tuesday evening. And first of all, I'd like to just say a big thank you to MS Auckland for inviting me to come and speak to you guys tonight about a topic I'm exceptionally passionate about. Being a neurological physio is MS and exercise, and I'm presenting tonight on behalf of Rope Neuro Rehab. So Rope Neuro Rehab is where I work clinically. So I am there 4 days a week. I have had a passion treating MS really for about 20 years. I've been a qualified neurophysio, and I had a really good period where I worked in Australia for about 4 years and was at a really quite a revolutionary practice called Advanced Rehab Centre. And that's where we had the brainchild to start MS Get a Head Start. So MS Get a Head Start is an international 6-week program on exercise and health behaviour change and education, which I developed and we launched internationally in about 2018. So that's kind of my background coming to you today, is neurological physio. I treat hands-on 4 days a week. I run MS Get a Head Start, and very excitingly, I'm just embarking on my master's at AUT to do a research project in MS Get a Head Start. So for those of you who want to know more about that, keep an eye on your emails, because hopefully something will be coming out later this year through MS Auckland to help me with research participants. So today I'm going to talk to you for probably about 30 minutes or so about exercise, which isn't actually all that long, because I can probably talk about the benefits of exercise for hours. So I'm trying to give you guys a bit of a snapshot of the real important things to understand about exercise and MS. And yes, it is absolutely essential for your best management of your condition, but also help with either demystifying some issues around exercise, you know, some top tips, but also really trying to help with those challenges, because if it was easy, then you'd be doing it. Okay, so for those of you who find exercise is really difficult, or you know, you've had some bad experiences, hopefully from some stuff I talk about today can really help with that. So as I say, it is all about exercise, and there isn't anything unfortunately to get around it by not doing. Now, I forgot to say at the start, please pop your questions in. You can put your questions in by using the chat function, which is on your Zoom screen. So you can type any questions into your chat function there. I will keep doing the main part of the presentation to the end. But if a question comes up, feel free to put it in anytime, and then we're going to have plenty of time for questions and answers at the end. Now, what I obviously can't do in today's session is necessarily do any individual advice, but if you've got a question, I can definitely make it generalized, so the majority of the audience listening can really get some benefits from those questions as well. So don't be shy with the questions. So if exercise were a pill, it would be the most prescribed drug on the planet. And wouldn't it be easy if all we had to do was take a pill and we have got ultimate health and wellness? You know, there's a lot of companies and there's a lot of money going into that. But as I say, there is not a condition that would not benefit from exercise. Now, whether that is a neurological condition, diabetes, heart disease, cancer, you name it. So unfortunately, if you've got a diagnosis of MS, it doesn't mean that you're immune to other conditions. So there is, you know, several of you, plenty of you maybe on today's call who have MS as well as something else. You know, it could be arthritis, diabetes, you might have had cancer, all of those types of things. And the good thing is that exercise is not a contraindication for anything. Exercise is actually beneficial to every health condition we have. So that's the good point. The reason why I really push exercise so much in MS is that for about the last 30 years that we've been having published research, so we call it evidence-based works, or the research that's published, is that individuals with MS are, well, there's 80% of people with MS are nowhere near the activities guidelines. So, you know, in the World Health Organization, they make this recommendation of how much exercise is needed to be a healthy individual. And as I say, to this point, 80% of people living with MS are nowhere near that. So there's only 20% of people with MS who are actually getting towards those activity-based guidelines and probably living a much more optimal wellness with their MS. So to say, what is really concerning about this is that there's been a lot of published research about the benefits of exercise, which I'll talk about a little bit more in a couple of slides. But with all these great benefits published and people knowing that exercise is so beneficial, is why do we still have an 80% inactivity rate? And that's because, as we all know, exercising is actually really quite challenging when you've got some significant MS symptoms, which we'll talk about in today's session. But also it's hard. You know, if it was easy, then, as I say, then we'd be trotting along. But this stuff is hard. So let's just start with the problem of inactivity. So it is that classic saying, if you don't use it, you lose it. So as soon as you stop being as active, your muscles get weaker. So let's take an example of, let's say, if we look at someone over a year and, you know, they are quite happily walking 500 meters with a stick, and they might have a foot drop aid or something, but they can walk 500 meters with a stick, and they can do that walk quite easily. Then they get a flu, they get COVID, they fall over and break an ankle and their ankle's in plaster. So they have something that knocks them off their feet, which is not their MS, okay? MS has been stable, but they have an event that knocks them off their feet. So if we take, you know, flu, in bed for a couple of weeks maybe, or say broken out ankle, you've got your foot in plaster, you only need 1 week in bed to lose 20% of your muscle mass, okay? So if you've already got some weakness from a neurological condition, and then you go and lose 20% of your muscle mass, your strength, from being inactive due to a common problem that can happen to everyone, then you might only get back to that year walking 200 or 300 meters. So what then happens where you were walking 500 meters the year before, if you don't get your activity level back up to 500 meters, you will naturally lose your fitness and strength to only be able to walk 300 meters. So as I say, if you don't use it, you lose it. And obviously, as we become weaker, then we find function is harder. And as we become weaker and function is harder, and obviously we need to keep living and we want to try and stay independent, we start compensating. So we start coming up with bad habits and we drag a foot around, or we use furniture for balance, and we start using these compensatory mechanisms more and more, which means that we're not using our muscles in the best biomechanical alignment. So then we get weaker quicker as well. So this inactivity, as I say, it's weakness, it's loss of function, which then leads to loss of quality of life. Yeah, it can cause increase in things like depression and all of those types of stuff. So I'd say the downsides of inactivity are really important. Another important factor to remember is, unfortunately, that thing called aging, is that from the age of 40 is every decade you are losing muscle tissue. So this is called sarcopenia. So sarcopenia is the loss of muscle tissue that naturally happens as we age. And every decade over 40, that muscle loss gets more and more and more. So it's actually more important, no matter whether you have MS or not, if you are over 40, it is more important that you are doing heavy weight strength training in your 50s, 60s, 70s, 80s than it was when you're in your 20s. The other real challenging thing here as well is if you are a female, and unfortunately we know MS affects more females than the males at a 1:3 ratio, is that if you are female, that when you go through the menopause, you have an accelerated loss of muscle tissue. So we kind of get a bit of a double whammy. So as I say, this is irrelevant if you've got MS. Just being female, aging, and then post-menopause, you have significantly lost even more muscle tissue. So the way to combat all this loss is by being more active, okay? And in particular, it is this dedicated strength training. So general benefits of exercise. I read a really interesting article, which is the last article on this, references down the bottom, Lamont and Mottle 2021. Now, there's a full list of references at the end of these slides, and a copy of these slides will be going up on the MS Auckland website with this recording as well. So that will all be available for you, for everyone. So if you want to look into some of this research, there's 2 main articles I'll talk about. Feel free to look into these a bit further. But what it said, which was an interesting fact, that over the last 30 years, MS is the most researched neurological condition with exercise. So there's been more published research on the benefits of exercise for MS than Parkinson's, stroke, spinal cord injury, any other neurological condition. So that's pretty important stuff to know. So the general benefits are, so exercise has been shown specifically in the MS population to improve heart health, so cardiovascular function, so your heart and your lungs. It's been shown to improve mental well-being, so, decreasing depression, and more enjoyment in life. It's been shown to strengthen muscles, improve function, so walking distance, walking speed, balance, hand function, being able to grip and lift things. Exercise has also been shown to improve gut health. And those of you who are on the call or this webinar who are quite interested in things like gut microbiome and nutrition and diet, that those who exercise with MS have an improved gut microbiome than those who don't. Obviously, because of exercise, it can also help manage weight. Exercise has been shown to improve fatigue, and I will talk more about MS and fatigue in a couple of slides, so don't worry too much about that one at the moment. Exercise can improve neuropathic pain, so those of you who have that horrible burning kind of pins and needles pain, you might have what we call the hermits, which is when you put your head down, you get that shooting spinal shock down through your neck and down through your back. Or you might have what we call the MS hug, where you've got that tightness around your rib cage. Okay, exercise has been shown to significantly improve both those symptoms. When we talk about MS, a lot of people think about, the physical impairments that can happen and the physical challenges. But those of you living with MS know that there's a lot of symptoms that can't be seen, So things like, your fatigue, your, mental health and things. But one of those things is cognitive function. So, that ability to process things at speed gets affected with MS. And exercise has been shown to be the most powerful thing you can do to improve your cognitive health. So if you think, oh, physically I'm pretty good, but you've noticed that, that brain's not ticking over quite as quick as it could, or you're starting to forget things, then exercise can be really powerful for you. So as I say, so we've got all these fantastic benefits of exercise. We've got bone health, reducing fractures, improving your balance, all of these things that can just improve your quality of life. So these are all the golden nuggets. However, now, and this is research that's only really been coming out in the last few years, now there's something even more exciting. And I can't express how important the next point is the neurological benefits. So I've been talking about neurological benefits with MS for a long time, and I used to get reasonably well challenged when I talked about exercise and remyelination, but we now have some really good articles to show that there is a really strong potential this happens. So what we're talking about here, we are not talking about curing your MS. We're not talking that we can completely halt the MS, okay? But exercise is one of the most powerful things you can do from a neurological protection. So to slow your MS down is exercise. It's because when you exercise, you promote neurological protection and remyelination. And you don't remyelinate unless you are active. You need your body to move. You need to move in patterns and use muscles and nerves to remyelinate. So when we think about those of you who might have relapsing and remitting MS, okay, obviously you have the relapse is when you've had an event and you've got some scarring and you lose some function, you get a bunch of impairments. Your remission is when there is some healing of that demyelinated area and you go back up. Now, ideally, you can go back up to the same level you were. Unfortunately, some people may only go back up to 2/3 of what their function was before. But that is remyelination. Now, if you aren't getting expert input post a relapse, you are potentially robbing yourself of the potential to really optimize that remyelination. So say this is some really, really exciting stuff about the benefits of exercise. So slowing down your MS progression, promoting remyelination, reducing brain volume loss, okay? And so that should be, sorry, that missing a word on there. It's got exercise reduces brain volume loss, okay? So improving brain volume. Positive plastic adaptation of the central nervous system, so that's what CNS stands for, the central nervous system, so that's your brain and your spinal cord, is possible for people with MS irrespective of disease severity. So it does not matter if you are newly diagnosed or even been diagnosed for years and have pretty much no impairments compared to someone who may have been in a wheelchair for 20 years, okay? You still have the potential to make plastic adaptations, to make promising changes to your neurological system for improvements. And the stat at the bottom of this slide is really powerful. Exercise can reduce relapse rates by approximately 27%. So quite a lot of you who are on this call who may be newly diagnosed or have relapsing remitting are probably on some form of disease modifying therapy. So some of those drugs and all of those drugs are aiming at reducing relapse rate, okay? Exercise can do this as well as by increasing you by up to about that 27%, which is really, really powerful. Now, to achieve this, we also have to work very hard, okay? And not hard in hours and hours and hours of exercise, but hard in intensity. So to get this neurological effect, we've got to get comfortable with getting puffing and panting out of breath. But to do that, we have to do it safely. And that's what the rest of this talk's going to talk about. So just to recap the last 3 slides. Inactivity is what causes loss of function, okay? That is that your inactivity and your lack of exercise is going to cause you to decline quicker. Exercise has been proven to assist in all sorts of general health and function and quality of life, but most powerfully, exercise has the ability to be neuroprotective in slowing your MS down and helping to remyelinate and give you an opportunity for a better quality of life. So the challenges. Now that we've obviously all those great new things, some of you will be really familiar with all those exciting things, some of you will know them really well, and you'll go, well, to be honest, Gilly, I spend most of the time just trying to survive the day, okay? So out of that little minion here, is that just getting up, getting through a day and getting back to bed are sometimes all that you can achieve. So the kind of two kind of real big barriers to exercise or challenges to exercise that people with MS will report time and time again is fatigue, okay? And this can be real mind-numbing, brain fatigue and physical fatigue, and heat sensitivity. Now, some of you will really know that you're heat sensitive, and some of you won't know, but when I get to the slide to describe it, there might be a few of you on this call who go, oh yeah, that actually is me. So let's start with fatigue, okay? the important thing to understand is that there is 3 types of fatigue when it comes to MS. So central fatigue, okay, this is like your brain fog, okay? Those of you who really struggle with the, oh, I'm just wading through concrete, you know, my brain feels like it's full of marshmallows, you know, that brain fog feeling. There's a genuine reason why, okay? Because of the plaques, okay, so because of these demyelinated areas on your central nervous system, your brain has to work anywhere between 30 to 50% harder, even just at rest, compared to someone who doesn't have MS. So the way to think about this as an analogy is, if we think about a roadblock, you know, you're driving on a familiar route, let's say you're driving to work on a familiar route, and you come to some roadworks and there's a diversion. So you still get to work, but it's taken longer and it's used up more fuel. Okay, so you've achieved the same outcome, but at a cost. Okay, this is kind of what happens in the brain for someone living with MS, is that, you know, they have a thought, you know, thinking cognitively, or you're physically moving, but it's often 30 to 50% more energy is required to produce that same outcome. So this is for you to understand that there is a genuine reason of why you feel tired, okay? Now, the very important thing to understand about central fatigue is the human body doesn't know the difference between brain fatigue and physical fatigue. So the way to think about this is that, let's take your average office worker. They get up, have a shower, sit down to have breakfast, sit in the car to get to work, sit at the office in the computer chair 8 hours of the day, because I sit down for lunch. I might get up a couple of times, go to the bathroom or go to a meeting, but I spend pretty much the whole time sitting down working, sit in the car in traffic on the way home, walk through the door at home and go, oh my God, I'm exhausted. Now, we know that that's not physical fatigue because they haven't moved their body hardly at all. What they're experiencing is brain fatigue, cognitive fatigue. So when you start being able to differentiate between, all right, I'm really tired, or that's because I have gone and done a gym session, or I've walked further today than I would normally walk. You know, if you can say, yes, there's a genuine reason of why I feel physically tired. Otherwise, a majority of your time, your fatigue is going to be from a cognitive point of view. And exercise is going to improve that. So though you feel awful and have no desire to exercise whatsoever because you're so tired, exercise is what's going to make you feel so much better. The way to manage central fatigue, and there is a fatigue management webinar already on the MS Auckland webinar resources, but the quick way to manage central fatigue is a rest. So I prescribe any individual with MS that walks through my clinic doors is that they need 10 to 20 minutes of complete rest. So that is no reading, no listening, no nothing, eyes closed, okay, even if it's just for 5 minutes where they switch their brain off in the middle of the day. So it sounds easy. It's one of the hardest things that you'll ever make a habit to do because life gets busy and you'll never make it a priority. But if you can make taking a rest in the middle of the day for 10 to 20 minutes, you will thank me for it. After about 2 to 3 weeks, you'll start to see a significant improvement in your central fatigue. So then we've got secondary fatigue. So secondary fatigue is lifestyle influences. You know, if you are not sleeping properly because of leg spasms, you've got pain, you're struggling with insomnia, you might have depression, you might just not be going to bed till midnight and getting up at 5 a.m., which is not enough sleep. You know, medication can cause fatigue, poor diet, dehydration. So often, you know, what our role is also to look at what lifestyle factors can improve your fatigue. We live in a busy world nowadays. There is not many people, even outside of those with MS, who don't complain about feeling exhausted. Okay, too much screen time, too much demands. So there is a lot of lifestyle things that can be done to improve your fatigue. And the third one, which we will talk a little bit more about in a couple of slides, is your neuromuscular fatigue. So this is where you've got physiological damage, okay, to the nerves, okay, and what you need to do is actually change how you exercise. So if you go walking and you just try and walk for as far as you can, for as long as you can, and you end up a wobbly mess and tripping over, if you keep trying to push that, you're probably just going to fall over or hurt yourself or biomechanically compensate. So what we've got to look at is that physiological fatigue. It is real, and we've got to manage that so that you can exercise to get benefits to allow you then to walk further. And again, I'll talk about this in a couple of slides. So heat sensitivity. So some of you, as I said, some of you will know that you're heat sensitive, some of you will not know at all. But if you struggle with significant fatigue, I can probably guarantee you've got an element of heat sensitivity, because there's some really lovely research that looks at cooling actively every day can improve fatigue levels. So you only need a 0.5 degree increase in your core temperature to cause a slowing down of your nerve conduction. Okay, so what that happens then is you get a temporary exacerbation of symptoms. So for those of you who may have noticed this could be weather dependent. Okay, you might be out in the hot sunshine. Okay, this can be heat from inflammation, you are unwell. It can be from psychological stress, but often it's from exercise. When you exercise, you naturally increase your core temperature. So you only need this increase of 0.5 degrees, and you'll start noticing things. I mean, who's been to the gym and exercised or been out in hot weather and noticed that they've suddenly got double vision, or their MS side's gone numb and tingly, or they start dragging your foot, or you start dropping something, okay? And this is because that nerve conduction's slow. But it is a temporary, okay? It is not a relapse, but it can be really scary. If you have been diagnosed with MS and then you go off to a gym to exercise and you have this horrible exacerbation of your symptoms when you get on that exercise bike, you're probably going to go, no, thank you, that was awful. So we need to really manage this because it is temporary. As soon as your core temperature cools back down again, those symptoms will settle, okay? So this can be managed with proactive cooling, okay? And the main thing I recommend here, okay, is these metal kind of thermos bottles that you can get for a dime a dozen now, is to get ice cubes in a blender with a bit of water that you're making an ice slushy. Fill the bottle with that. That will stay like an ice slushy for about 4 hours, and keep sipping that. Sipping icy cold water will drop your core temperature the fastest, and that will help to maintain that core temperature so you don't have such a symptom exacerbation. If you want to know more about heat management, and I did do a webinar for MS New Zealand, I think then MS New Zealand earlier this year. So on the MS New Zealand website page, there is a webinar, which is about a 30-minute webinar specifically on heat management. So if you want to get more details about how to manage that, head over to that website. So neuromuscular fatigue, how are we going to stop this kind of wobbly body, the foot drop, the hand dropping stuff? So it means that when you exercise, you need to exercise in intervals. So what we talk about an interval is, let's say you walk for 2 minutes and then you sit down and have a rest for 2 minutes. And then you walk again for 2 minutes and sit down and have a rest for 2 minutes. It might be that you do 5 reps of an exercise, have a rest, and then do another 5. So rather than that classic, let's do 3 sets of 10 of something, we might need to change that. Well, actually, not might, we do for MS. And this is why exercise in MS is highly specific. And if you have not seen a health professional who is experienced in MS and knows these changes, then you need to, because otherwise you could be trying your best at the gym or at home or wherever you do your exercises and just feel like you're just constantly, not getting the results you want. So we talk about an exercise to rest ratio of 1 to 1. So that example is if you've done 30 seconds of exercise then you need 30 seconds of rest. If you've done 2 minutes of exercise, you need 2 minutes of rest. So there's one way that you can do exercise there. So here we go, 30 seconds of exercise, 30 seconds of rest. And then the other one is strength training. So rather than 3 sets of 10, I will be prescribing 5 reps, 6 sets. So let's say it's sit to stands, okay, or squats. You do 5, then you rest. 5, and then you rest. So the reason why these are intervals is so that you can actually go harder and heavier. So you can lift or push a heavier weight with your strength training, which means that you are going to get physiological adaptations and improvements quicker. It means, let's say on an exercise bike, that if you're only going for 30 seconds rather than 20 minutes, you can go as hard and fast as you can to get speed, to get better, faster physiological adaptation. So how much exercise is often the question, and this is why I'm sure lots of people are on the call. How much do I need to do? Now, there's a great article by Caleb et al. That was released in 2020, so 3 years ago, but released in the middle of COVID, so it's taken a while for a lot of it to get out into common practice. But this is basically the exercise guidelines, the latest evidence-based exercise guidelines internationally, which every person in MS with MS should know about, because this is what they're saying is researched of what people with MS need to be doing. So again, this article is freely available. So for those of you who want to get some more information about this, please go find it. What's really unique about this article is that it tells you how much exercise is needed throughout the MS trajectory. So they use a scale called the EDSS, so the Expanded Disability Status Scale. So some of you will be familiar with this, that your neurologist may have talked about it, or the MS nurse, or you may have read about it. So some of you will know your EDSS scale, some of you won't, but don't worry, it's from 0 to 9. And this article and this guideline talks about what you should be doing at each point. So from 0 to about 6.5, we're going to talk about in a moment. And then after 6.5, it also talks about what you should be doing at 7 or 8 or at 9 EDSS. So it can be a lot more specific. Now, don't get scared about the next slide. This is gold standard. Okay, this is how much exercise we need to be aiming for. Now, before you all panic and go, oh my God, this is ridiculous, is that this could take a couple of years for some of you to get up to, okay? It doesn't mean go out and try and crack it tomorrow, but it's important that you understand where the evidence is showing is actually achieving these gold standard results. It is where you are going to be getting that remyelination, that neurological protection, that improved quality of life, that strength, that function, that real optimal living well. The reason why you're putting all this effort into exercise is to live well. So it starts with this aerobic zone. So about 3 times a week, you need to be between 40 to 60% of your predicted heart rate max for 10 to 30 minutes. But importantly, more often at 5 times a week, you need to be really pushing yourself. So 70 to 80% of your heart rate max is out of breath enough that I can't talk in a full sentence. Okay, so if I'm exercising and I can chat along, you're probably at your aerobic level. To be at your advanced aerobic level, you're really starting to have to suck that air in. And then once a week, you have to go all out, okay, and be at 90 to 100% of your cardiac volume, that you are going for it. And luckily, they've said only for about 30 seconds. So though that looks at 3 times a week, 5 times and 1 time a week, that you're like, oh my God, that is my quick maths, 9 times a week of exercise just for cardio. No, it's not quite 9 times. It's basically 5 times a week of cardio. And within that 5 times, you want to make sure one of those sessions is at that 90 to 100%. So you're absolutely puffing, panting, maximal. And the other 5 times a week, you are getting out of breath for a short period of time. And then you've got some longer periods of time with some endurance. Okay. Strength training. You should be doing dedicated strength training, which is actually moving some weights, okay? So not just your body weight, but actually a load. So whether that is going to a gym, whether that's a Pilates reformer, whether that is some weights at home, okay? It might just be a simple thing like a weighted vest. The really good thing we have now is things like, not to promote unsustainable shopping here, but places like the Warehouse and Kmart sell exercise equipment really cheaply now, that you can get a 9 kg weighted vest for $25. You can get 2, 3, 4, 5 kg weights for not much at all. So, you know, the accessibility to weight training is definitely improving. So you need to be doing a minimum of 5 strength exercises twice a week, okay? Flexibility, okay, so you should be doing some form of stretching every day to keep the body supple. And then if you've got a neurological impairment, so if you have foot drop, you've got hand weakness, you know, you're struggling to do up buttons, you're struggling on your to type, if you've got balance problems, if you've got pain, like if you've got something that's a specific issue, that's when you then need to see a neurophysio, and you're probably spending about 20 to 60 minutes, anywhere between 3 to 6 times a week, on working on that specific issue to get it better. Now, once that issue has got better, you are then doing that top part of the table. So you're doing flexibility, strength, high intensity, and your aerobic training. So your neuromotor is only when you've got the impairment you want to work on. So I've talked about that, and lots of you will be going, oh my God, because I can tell you there is a huge amount of the population who do not have a neurological condition, who are nowhere near that active. But as I say, you are potentially prescribed or taking disease-modifying therapies because they're trying to improve your MS. You may have completely changed your diet because you're trying to improve your MS progression. This is the latest evidence about what you actually need to be doing from a gold standard to improve your MS. So say it is pretty scary, and so I don't expect anyone to be going out there and knocking this off tomorrow. This could take a long time to get to, and for some of you, you might not get there, okay? And as I say, this is for those of you between 0 to 6.5 on the EDSS scale. After 6.5, it changes quite a bit between 6.5, 7, 8, and 9. And all of that information is in that article. So before I've scared you all to death, we're going to do the basics, okay? So if you're going to go away from today and think, okay, well, what do I just need to focus on for the basics is, can you do some cardio exercise where you get your heart rate up 3 to 4 times a week, even if it's only for 5 minutes? Let's just try something simple. Can you get your heart rate up 3 to 4 times a week for even just 5 minutes? This can be achieved. My 2 kind of top tips about best ways to get your heart rate up. Boxing, i.e. just standing or sitting there and moving your arms as you're imaginary boxing for 30 seconds as fast as you can. That will get your heart rate up. Or an exercise bike, because both are safe. Don't worry about balance, okay, and they're relatively easy to do. And the other one is start strength training. Strength training is the point that you're going to improve your function, okay? And it is the part, and especially as the aging individual, so anyone over the age of 40, that people forget to do. People often go and do the walks and the cardio, but people often forget the strength. So as I say, we've got this big table here, which is gold standard, but for a lot of you, this is just going to be far too overwhelming to consider at the moment. So considerations from today: can you be doing something to get your heart rate up 3 to 4 times a week, and strength training twice a week? So you're looking at 6 days a week of exercise. So who to see? So it isn't a shameless plug. It is the fact that MS and exercise is actually really, really complex and highly individual. So you will have hopefully your neurologist, your MS nurses, your MS community advisors will all say exercise is good for you. And you might go to the gym and you might see a personal trainer, you might see a normal physio, but you really need to seek out a neurological physio to find out exactly what you need to do to get the best results for yourself. So someone with MS experience so that you can actually achieve your best. So it is really vital. But once you get set up well, so give you an example, I might do an assessment, I might see someone 3 to 4 times relatively close together to get them, really well established. And then I see people once every 6 to 12 months to just keep tweaking programs and working on goals. Okay. So when we say you need to see an expert, we're not saying that you need to see an expert every week for the rest of your life. It's about seeing an expert to get the advice and the plan. Then you can execute the plan yourself. Okay. And then you're just seeing the expert for these top-ups. Okay, so here are my top tips. 85% of your brain is fluid. If you do not drink up to 2 liters or more of water a day, okay, now obviously if you have fluid restriction because of heart health, this isn't for you, but if you don't, 85% of your brain is fluid. If you are not drinking 8 large glasses of water a day, you probably have a shriveled raisin for a brain rather than a nice plump juicy grape. A dehydrated brain will be significantly fatigued, cognitively slower, and you will struggle to exercise more. So please hydrate. If there's anything you do from today, just try and increase a load of water. As I talked about, a rest, a sleep, a little nap, a bit of quiet time, 10 to 20 minutes of a brain rest. No reading, no looking at Facebook, no listening. You're just going to chill out, okay, with your eyes closed, 10 to 20 minutes around lunchtime every day. Diet is really important, but there is no specific diet that's been shown to be superior with MS. There's a lot of diets out there. There's the Gelic diet, there's the Overcoming MS, there's the Terry Wahls protocol, but basically it's a low inflammatory diet, lots of fruit and vegetables, and keep those processed sugars as low as possible. Active cooling, get some ice cubes made, start really cooling yourself before exercise, during exercise, and afterwards. It will make a significant improvement. Best piece of exercise equipment, I often get asked this, what would be your number 1 piece of equipment? If you have MS, it's an exercise bike, okay? You can use an exercise bike to get beneficial changes from newly diagnosed right through until you're probably at about 6.57, okay, on that EDSS score. It is safe, okay, they're low cost, they do not take up much room, okay? So an exercise bike is always my number 1 go-to. And the bit that most people forget when it comes to exercise is strength training. Do it twice a week, and where you can and where you've had expert advice, trying to load that weight. So they are my 6 top tips for today. So take home messages. Exercise is a really powerful tool against MS progression. And I really hope you take on today's talk with a spark of energy, and that you can go and feel empowered and really try and make a difference. Remember that something is better than nothing. We all have days, weeks, months where it all just falls apart. A 5-minute walk is better than a 9-minute walk. Let's say that you're trying to do 30 minutes of walking every day and you don't have 30 minutes. 5 minutes is better than nothing. Let's say that you want to do your strength program, but 5 exercises is going to take 45 minutes and you don't have 45 minutes. Just do one. Just do 1 round of strength exercises. It's about creating the habit and that positive change. Don't beat yourself up if you can't do it all. Just do something. Something is always better than nothing. Exercise can significantly improve fatigue because a majority of your fatigue is probably central, which means it's cognitive based, not physical. Active cooling can make exercise significantly more enjoyable and a lot less scary if you get symptom production. You do have to change how you exercise. So that interval training and that low reps, high sets. You know, I've worked with people for years who keep coming back and going, oh, I'm not getting better, or I keep getting all these symptoms, and they're still trying to do 25 minutes continuous on the bike. And I'm like, no, we need to create that as intervals if we're going to make progress. And also that weight training has to change as well. And lastly, you need to seek expert opinion, because this has been a generalized talk and everyone of MS is absolutely individual. There's no other neurological condition that can be as individual as MS, because you can get that damage anywhere in the brain, anywhere in the spinal cord, in any form or combination. So as always, I do talk way longer than I always think I do, but there we go. That is me finished. We still have plenty of time for questions, and I see that a few have come through, but as I just allow a little bit more for questions to come through, please type them in. So I can be reached on the email address there, which is gilly@rope.neurorehab.co.nz. The Rope Neuro Rehab website has more information on, and if anyone's interested in the MS Get a Head Start program, that is the web address there. So I will leave that slide up for people for a moment, but as I said, copies of slides and the recording will be available. So well, I'm going to start with the first question I've got here is, how do I get back to 9,000 steps a day? I had a bladder infection, then had COVID, so I was inactive for 2 weeks, and now I'm only managing 2,000 steps a day. So this is this classic, okay? You get knocked off your feet by something. So first of all, when it's something like COVID, there is really strong guidelines about avoiding long COVID, is that you should not be attempting to exercise until you are at least 7 days symptom-free, and you can perform all of your activities of daily living. So getting washed, dressed, doing the shopping, going to work without any symptoms. When you can do that, then you can start exercising. But let's say you're at 2,000 steps a day and you were at 9,000 steps a day. So my recommendation would be each week have a goal of trying to do 500 steps more. So let's say this week you're going to start now by aiming to do 2,500 steps. Next week, that's 3,000 steps. The week after, it's 3,500 steps. So you're just giving yourself a really nice little small increment that you can keep doing. I'd also recommend, when it comes to step counts, is don't leave it to look at your watch at the end of the day. Have a look at your step count at lunchtime to see how much you've done already in the morning and how much you might need to do. Even check your watch at 10 or 11 o'clock, because you do not want to be leaving 5,000 steps to do after 5 p.m. Okay, so try and space it out. We've got a question here about, what's your top exercise tip to strengthen hip flexors? So hip flexors often get very weak. However, hip flexors often get weak because they are compensating, they are overworking because of a weak calf muscle. So the way to test this is that if you hold on to something sturdy, so you're holding onto the kitchen bench or the back of a chair, can you stand on one leg and push up onto your tiptoe without your knee locked? If you can do that 5 to 10 times on each leg, then it's probably just your hip flexor, okay? If you find that you can't really push up on one foot, then isn't really your hip flexor. It's the poor hip flexor's fatiguing because it's doing the job of two muscles, okay? So first of all, it will be looking at, why is your hip flexor weak? Is it compensating for something, or is it pure weakness? Hip flexor strengthening, to be honest, I'd probably do a lot of, if it's pure hip flexor, I'd probably do a lot of stairs, okay? And I'd also do a lot of backwards walking, because that can also really help. So I've now got someone asking, what sort of exercise bike would suit people with limited leg function? That's a good question. It depends how limited you are. So if you've got one leg that can pedal the pedals pretty well, then a standard exercise bike can probably work for you. If if your balance is really not very good and you've got a very weak leg, so getting it over the bike or getting it into the bike pedal is really quite challenging for you, then I'd probably recommend one of those recumbent bikes, so those bikes that you sit back into a chair and then put your feet in. Okay. Otherwise, if you've got really very weak legs and, you know, let's say you are walking maybe only a couple of meters, you know, like with a frame, you might just be transferring. Then we go to, unfortunately, stuff which is a bit expensive, but there's a couple of bikes which can do active and passive leg cycling. So there's one that's in a cheaper price bracket version called the Super Pedal Pro. And then there's a little bit more expensive, well, it's quite a bit more expensive, is looking at something called a Motormed. They are a big cost, but they can be really valuable. But also have a look around where there may be something like that in your local community. I've just been asked if Rope do some group classes. Yes, they do some exercise group classes. We don't necessarily have anything MS specific at the moment, but bear with us because I've only been with Rope for the last couple of months, and don't you worry, we will be starting an MS maintenance class, and some MS Get a Head Start classes will be happening. So if you are interested, then please feel free to email Rope and we can put your name down. Here we go. I've got a great question here, which would have come from the water, okay, intake, is the thing that many of us don't like to talk about is urinary incontinence. Is exercise likely to help? And if so, what exercise apart from Kegels? So first of all, so when we talk about urinary incontinence, and this is for male and females, we talk about urgency, frequency, and incontinence. So any of those three. Now, for some of you, you could have all three. For some of you, you might just have frequency, and some of you might just have urgency. If you've got any urinary issues, number one, referral to a urologist. If you've not ever seen a urologist, ask your GP to refer you now. If you last saw a urologist more than 2 years ago, please get re-referred. The advancements in urinary assistance through urology is improving year on year regarding medication and Botox injections. The other area, when you get your urology referral, if you have not seen a pelvic floor physio. So we say pelvic floor rather than women's health or anything, because it's not gender specific. There's men's pelvic floor issues and female pelvic floor issues. There is now a whole, just like I'm a neurophysio, so you would not come and see me for a knee strain, okay? You would only come and see me for a neurological condition. There is now physios who purely specialize in pelvic floor. So you can actually Google pelvic floor physio, and they often have it in their title, like there's ones in Central Auckland called the pelvic floor physios. There's one on the North Shore called Physio Down Under, which I quite like that play on words. But a pelvic floor physio is now going to do significant assessment to work out what exercise is going to be specifically good for your bladder presentation. So general exercise, all that cardio and strength training is, yes, going to help improve incontinence because it improves all of your muscle strength. But if you've got any form of incontinence issue, I cannot recommend highly enough is invest in seeing a pelvic floor physio for a few sessions. It may be a cost because it might be private, but you can go publicly. So I will re-say that, sorry, you can go to your GP and ask him to refer you to your local DHB, so part of Te Whara Ora, local DHB urinary physio, so pelvic floor physio. Then wait times are lengthy and the criteria is a bit iffy, but it can change your quality of life significantly. Those of you who struggle with incontinence, it is life-changing. You are constantly thinking about it. You are constantly worrying about it. If you can improve that, even if it's improved by only 50%, that can be life-changing. So do invest in that. My next question is someone who's got primary progressive and is deteriorating. So unfortunately, those of you who may be aware, there is different types of MS, and some are, more impactful than others. So as as they exercise, the fatigue worsens. And, basically, should this be reassessed? Yes, it should, because what we're teaching today, so that research article that I talked about, that's not necessarily common knowledge throughout the physio world yet, that you guys are quite new on all this knowledge. So if you've been seeing a neurophysio, go back and see them again, okay? And because there could be things that could be changing, but also when you're exercising, that fatigue worsens. My question is to this individual is, how well hydrated are you? How interval based are those exercises? So let's say you're doing a 10-minute walk, and we broke that up into, rather than 10 minutes, you're doing 2 minutes as fast as you can 5 times, but for 2-minute rest. If you're still fatiguing through that, I might bring that to 1 minute. 1 minute really well, 1 minute rest. Okay, so there is lots of changes that we can do to make sure that your exercise is going to help create what we call physiological adaptation. So your exercise is not only going to maintain you, but improve you, but it might need a real bit of nutting out of how to achieve that. Okay. Awesome. Is there any other questions? Please feel free to pop that in the Q&A button or in the chat button. I think I've got, I think I've answered all the ones that have come through. Please feel free to, we've got a couple of minutes left. We've got this for another 3 minutes. If there's anyone else who wants to put anything else in to ask me. But yeah, or I'll just kind of waffle along for a few more minutes otherwise, is that, exercise, it is scary, and it is really hard to make as part of your day-to-day life, but it can change the quality. But as I say, just as I was just answering some of those questions then, seeing someone with some expertise who can really guide you in the right direction is really important. If it was easy, you wouldn't have any issues. So that's all I can answer. I think we've just had one more question come through. Let me just see. Awesome. We've just had a lovely thank you to say that the individual feels like they've learned so much and life-changing already. So my pleasure. So I will stop the screen share now, and I think got a couple more coming through, but I think they're just thanks. Oh, here we go. We do have a question. Will exercise prevent me from going from a relaxing remitting to secondary progressive? This is a great question. And the reason why I say this is a great question, because there is part of the medical world who are now really questioning, is secondary progressive really a change in your neurological condition, or the fact that this cycling of deconditioning and inactivity has led to worse and worse MS? So the answer is, Fran, we don't necessarily exactly know, but what I can tell you is exercise slows MS progression. And if relaxing remitting tends to fall into secondary progressive, I can say, yeah, exercise will slow that progression down. And will it completely prevent it? Well, I'm going to cross every finger and toe and leg I can to say yes. Now, I don't obviously know if we can guarantee, because everyone's individual, but if you know that you have got to the gold standard of exercise and you still progress, you can be really grateful to yourself that you did everything you possibly could to slow your MS down. If you didn't, then are you going to question yourself, the what ifs? And sometimes through life, we don't want to question, oh, what if I did more in the past? If you can go through life and know that you did the best you can, then you know you have. Awesome. All right, I will close my screen now and hand you back over to Luminita and say thank you very much for having me.
Thank you so much,